Our next speaker is Cook County Board President. She is a frequent attendee at City Club events, for which we are enormously grateful. Ladies and gentlemen, Toni Preckwinkle. Madam President.
Thank you, Jay. Good afternoon, everybody. Good afternoon. Our guest today is Chief Executive Officer of Cook County Health and Hospital System. He's a graduate, like his father, of St. Ignatius College Prep. He got his bachelor's degree from Spring Hill College and his medical degree from Rush Medical College. He spent most of his professional career, a slight 8-year sojourn in Texas. How long was that? 9 years in Texas, but he's back. As I said, he spent most of his professional career at Cook County Hospital and now John Stroger Hospital. He and his wife, Robin, who's here with us today, live in Riverside. Please welcome him.
Thank you, Toni. Thank you, Jay. And thank you, everybody, for coming today. I'm pleased to have the opportunity to share with you today the progress that our health system has made in the past year. Before I launch into those remarks, I want to take a moment to recognize and thank President Preckwinkle for her unwavering support of the health system. The health system's board of directors, my chair and biggest boss, Hill Hammock, and my other directors who are here today. The directors have given us invaluable guidance as we've matured the health system, and also the Cook County Board of Commissioners for their collective commitment to our mission to serve all those in need. I also want to thank my staff that are here today. They're scattered throughout the room. They're all on vacation time while they're here at lunch. And the members of my family, as Jay mentioned, who are here as backup in case my remarks get me into trouble. I also want to thank my wife, Robin. I'll tell you, last night when I was reviewing this, she edited my comments and inserted my lovely wife, Robin. I took that out because actually the descriptors for her would take too long, so I'm glad she's here. Now, my remarks today will address our health system's priorities as we transform into a modern provider of choice in Cook County, while continuing to fulfill our historic mission, caring for all, regardless of their ability to pay. Last year, I shared with you the ambitious plans we have for transformation, plans to create a modern, integrated, patient-centered health system. For those of you who are frequent flyers in the room, and there are a lot of those I see, I hope you'll indulge me and allow me to remind you of some critical changes that have impacted our system, as well as progress on the priorities that I outlined last year. Now, there's no doubt that the Affordable Care Act has been a game changer for our health system. It gave us the opportunity to start County Care, our Medicaid managed care health plan. And by seizing that opportunity, it gave us the opportunity to stand strong for thousands of individuals across the county that we cared for previously when they were uninsured. Now, amidst the complexity that sometimes approaches chaos in the modern healthcare market with mergers, acquisitions, alignments, and disalignments, even closures, the Cook County Health and Hospital System remains committed as a dependable asset for our county. Regardless of the regional or national landscape, we'll be here. We have the unique responsibility and unique resources to provide care to our community's most vulnerable patients and those who rely on us for care. But we're seeing a change in those populations themselves. Now, I mentioned some of this change last year, but I want to share some numbers with you. In 2013, more than half of the patients we cared for in our health system had no health care coverage, and 30% were covered by Medicaid. Today, those numbers are reversed. Half of the people that we care for have Medicaid, and 30% are uninsured. In total, almost 70% of the people that we see today in our health system have coverage. Now, I'll tell you that when I started in 1990 at the old Cook County Hospital, that was about 25%. Today, it's almost 70%. With that coverage, that's an important thing to recognize. With that coverage and with that access comes choice, and that's a very good thing. Now our patients can choose to get their health care at almost any health institution in the area. Increasingly, we recognize we must earn the trust of the patients that we've historically served. Now, I'm proud to lead our system in this complex, competitive healthcare marketplace. For the first time in our history, we have to compete for patients. And to compete effectively, we need to change. We have to provide the services that our patients need in a manner and in a place that's convenient for them, and in facilities reflective of the quality of our care. And by staff who are not just clinically excellent, but who are also responsive and respectful to the patients we serve. Our vision for the future of this proud health system is that of a community-critical provider of integrated health care that advances the health of the entire community of Cook County. This patient-centered vision emphasizes ambulatory care, both primary and specialty care, offered in clinics in the neighborhoods where our patients live. People who are uninsured or underinsured have huge challenges accessing specialty care. This is something that Cook County has always provided to them. While any hospital will treat a patient having a heart attack in its emergency department, there are very few that will provide the comprehensive, ongoing, multidisciplinary care that's required with a new cancer diagnosis. No one is better positioned to do that kind of care than we are. We are recognized nationally and internationally for outstanding specialty and subspecialty expertise. But I think we have to realize that much of that reputation is based on hospital-based services. And now we need to show that we deserve the same kind of reputation for responsive, excellent specialty services on an outpatient basis. This is where the rest of the world is going. We've got to be there too. Our system first opened community-based clinics in the late 1980s. And many of you will recall that during the difficult economic times of the late aughts, in the midst of significant financial challenges, we had to contract that community presence, that ambulatory footprint, while other systems were marching ahead with expansion and innovative ambulatory strategies. But today, we're increasingly aware of the need to be responsible for significant populations of patients. Those impaneled in our primary care clinics, those in our health plan, those we care for in correctional health settings. Serving these populations best means our truly outstanding medical staff must move away from its traditional comfort zone. And by the way, this is my traditional comfort zone as well. It's something that a mentor of mine referred to as resurrection medicine, taking care of people out of emergency rooms, ICUs, and trauma bays. And we've got to move toward a community-based, anticipatory care model that emphasizes primary care and preventive care in a medical home, with ready access to specialists when they're needed. And while we have lofty goals, and we have many lofty goals, including an FY16 budget that anticipates a 15% growth in ambulatory volume, we have to prove to our patients that we're their provider of choice and not the last chance Texaco. Now, to help achieve this vision, we've launched a system-wide patient experience initiative and customer service program training all of our employees. We've created a patient support center that today fields more than 2,000 calls a day in dozens of languages from patients who need to schedule appointments or get a simple clinical question answered. We're staffing that support center in the evenings and on Saturdays, and we are recently adding clinical support in the form of nurses to the support center. That patient support center uses modern technology and integrates messages about the individuals we care for into our integrated health record, which is shared across both our hospitals, all of our 16 community-based clinics, our regional specialty centers, and even our correctional health care. Our clinics are expanding hours to include Saturdays, and we intend to expand to evening hours very soon. And we're evaluating the location and the layout of all of our clinics and the services that we provide in each of these clinics. Over the next 5 or 6 years, we intend to renovate or relocate our 16 health centers that are arrayed across the 950 square miles of this county to bring care closer to our patients and provide them with improved modern facilities. We want to expand the services that we offer our patients at the clinic level to include family-based care from children and expectant mothers up through seniors, and to include behavioral health services and dental health services, as well as specialty care and diagnostic services. Now, we have to do that based on a primary care model. We earned Joint Commission certification this year for our primary care medical home, the first step in helping our patients access care the way most of us in this room would like to, in a coordinated manner with a primary care team leading the way. Getting that certification made us one of only 11 health systems in Illinois and 151 in the nation who have received this level of certification for their clinic networks. Our primary care medical home model will move our patients away from emergency rooms and first come, first serve crowded clinics that treat only the current complaint and move toward treating the whole person. No one should have to wait for an acute emergency to develop to receive care if it can be prevented with effective primary care. As a father, I know firsthand how important it is, and I should point out, boy, that's pretty bad. It took me midway to find out that I missed introducing my daughter, Kaylee. Jeez Louise. Kaylee, stand up. That's pretty bad. I'm going to hear about that when I get home. Oh boy, all right, recovery time. Last year I mislabeled one of my brothers. Today I screw up with my daughter. I only have one of those. Okay. As a father, I know how important it is to be able to take your child to a doctor, whether a primary care physician or a specialist. Robin never let me take care of my own kids. And I know how important it is to be seen quickly and close to home. We will be building up our outpatient pediatric specialty services because we know that access to specialists is the biggest challenge for poor populations in Cook County. Now, I'm happy that medical advancements and public health advancements have reduced the need for acute hospitalization of children, improvements in vaccines, reductions in smoking, improved screening for lead toxicity, improved developmental screening for children. All of these things, coupled with better vaccines and better care for common pediatric illnesses, have reduced the need across the board for pediatric hospitalizations in the country, and our system is no different. Stroger Hospital is licensed with 40 pediatric beds, but on most days, we have only a modest number of children receiving care in those beds. To best care for these children in an efficient, safe, high-quality manner, we are co-locating 2 of our pediatric care areas that are currently separated, and we're going to staff those units to the volumes that we care for. Importantly, this will free up space in the hospital that will allow us to move our pediatric ambulatory specialty services out of the antiquated Fantis building that I've practiced in for almost 15 years. This will be good, not only for children and their parents, but it's good decision-making for county taxpayers. On another front, we have big plans for our behavioral health services. You're all aware, and you've heard about the efforts of people like Peter O'Brien and others to improve behavioral health services in the region. We know that there's a crisis in this country, simply not enough resources for individuals with mental health and substance abuse problems. Through County Care, our health plan, we've partnered with the Community Counseling Centers of Chicago, known to many of you as C4, to increase access to those behavioral health services for our health plan members. Recently, we received a grant from the Oath of Sprague Memorial Institute that allows us to begin planning a community triage center to provide prevention and diversion services for people with mental illness and substance use disorders. Working closely with President Preckwinkle's Justice Advisory Council and the Chicago Police Department, we hope to be able to divert hundreds from ending up in local emergency departments and the Cook County Jail simply because their behavioral health and substance abuse challenges haven't been addressed. This triage center will provide a more appropriate clinical setting for these individuals with a fragile mental state, certainly far better than a jail or an emergency department. And importantly, it will allow us to connect these individuals to community-based resources that they need. Now, we think it will save money, but importantly, it's clinically much more appropriate and it's the right thing to do. Now, while we work to transform our health system to succeed in the post-ACA healthcare environment, our long-standing clinical services remain strong. Kicking off this year, Providence Hospital received 3-year accreditation from the Joint Commission. Stroger Hospital received accreditation as a primary stroke center from the Joint Commission, the American Heart Association, and the American Stroke Association. Additionally, Stroger received accreditation as a comprehensive cancer care program from the American College of Surgeons, as a national burn center from the American Burn Association, and our dialysis services were again certified by the Illinois Department of Public Health. The services that we provide to adolescents in detention at the Juvenile Temporary Detention Center were just accredited by the National Commission on Correctional Health Care. I'm proud to say that our expertise in clinical services and our patient outcomes in many areas are on par with those of our academic health systems across the country. This is really important given the complexity of the folks that we take care of. But we must continue to raise the bar. As always, we're proud to serve those who for too long have had nowhere else to turn. The indigent, the homeless, those in correctional systems, HIV-infected individuals, and those catastrophically and unexpectedly injured. Many of our patients have complex lives and complex health conditions, and they require equally complex care. And more, we find ourselves caring for people who, although they may have health coverage, are underinsured because of high deductibles in their marketplace plan, rendering them effectively uninsured and financially vulnerable. Now, I can't talk about the transformation of our health system without giving you an update on County Care, our Medicaid managed care plan. In this past July, we celebrated County Care's 1-year anniversary as a county managed care community network. As an MCCN, different from our earliest days as an 1115 demonstration project, we were able to extend our health plan to include, beyond the ACA adults, those traditional Medicaid populations. Think of moms and their children, seniors and persons with disabilities. We partnered with the Medical Home Network and their accountable care organization to improve member care coordination and access to care, ease health system fragmentation, and reduce unnecessary health care spending. We've been able to leverage MHN's cutting-edge analytics and data sharing platform and their medical home-based care coordination model to make huge strides in managing our members' care, reducing ED visits, and improving follow-up to their primary care home of people who'd been in the emergency department or discharged from a hospital. Importantly, we enrolled more than 13,000 individuals in Medicaid through the intake process at the Cook County Jail. This helps to ensure that those individuals have continuity of care once they return to their communities. As the President frequently points out, the overwhelming majority of these individuals have not been convicted of any crime. They're awaiting sentence because they're too poor to bond out. And they go back to the communities that our organization has traditionally served. So we're proud to make that connection for them. Today, I'm pleased to say that County Care stands as the largest Medicaid health plan serving Cook County residents. That's helpful because you skipped about 3 of the other places where I put in pause for applause. So I'm grateful for that. With nearly 170,000 members, County Care enrollment has remained ahead of our FY15 budget projections from the start. Our budget for FY16 projects membership to grow to about 180,000 members, and it includes an ambitious goal of bringing more of the care that they receive and the revenue attendant to that into the Cook County Health and Hospital System. But just as important as the impact of County Care on our fiscal health, the Cook County Health and Hospital System receives a set per member per month payment to cover the costs of caring for our members, either within our system or in any one of our network providers. And I'll remind you that our network includes all of the federally qualified health centers in the county and virtually all of the hospitals in the county. So we have more than 140 primary care franchises for County Care. But if we attract County Care business into our health system, we're essentially reimbursing ourselves for the care that we provide. In 2015, this will total up for the Cook County Health and Hospital System about $200 million in reimbursement for services provided to those County Care members. Remember, that's care that we gave in the past with no reimbursement attached to it. In FY16, we are projecting $310 million in provider reimbursements to our health system. County Care has been a driving force in stabilizing our finances and helping us to make investments that position our system for the future. Now, it's important to share with you all, and I'm disappointed that Lawrence Masal's not here today, that we ended last year solidly in the black, improving our net position. That's another one. Improving our net position by more than $20 million. This is a momentous achievement for our system that has historically operated at a loss. For 2016, we have set a $1.5 billion operating budget for the health system. That budget was approved by the county commissioners last Wednesday. The Cook County fund allocation, that is the local tax support that we receive from Cook County, for FY16 is $121 million. This represents a $43 million decrease from FY15 and a $360 million decrease when compared to 2009, the first year that our health system board was in place. We're meeting both our goals of providing excellent patient care and being a responsible steward of taxpayer funds. Today, the county tax allocation represents 8% of our operating budget, despite uncompensated care costs approaching 20%. Now, it's important to note that while our tax allocation decreases, our obligations to protecting the health of Cook County residents does not. In 2014, we spent $340 million in uncompensated care. This is care for which we didn't receive payment. Now, importantly, that's down from more than $500 million in 2013. So that flip is directly related to expanded Medicaid coverage under the Affordable Care Act. But we don't forecast for that trend to continue. While the ACA has been a boon for many of our patients and certainly for our system, it's not a silver bullet. We are seeing many, many patients who, even insured, cannot pay their insurance deductibles or fees. And more may be eligible for insurance, but choose not to enroll for a variety of different reasons. A recent Chicago Tribune article reported that there are more than 175,000 individuals in the city of Chicago alone who are uninsured but eligible for insurance under the Affordable Care Act. As a result of these realities, we are projecting more than $400 million in uncompensated care costs in FY16. And I'd remind the audience that correctional health care direct costs account for $70 million in next year's budget. to allow, and this gives us the funding and allows us to implement several strategies we expect will yield returns in the future. But again, we get no compensation for the care that we provide in our correctional health services. Similarly, we get no compensation for the care that is provided by our Cook County Department of Public Health, which is why continued tax support is critically important to our health system. Now, my vision for this very large and complex health system is to create a modern, integrated system focused on providing high-quality health care to prevent disease and to protect the health of the communities that we serve. It's to get people the care they need, when they need it, and where they need it. Our success in becoming a provider of choice, in improving the patient experience, and in managing our finances is crucial for us to stay true to our mission to serve all, regardless of their ability to pay. This includes those who remain uninsured, those who are underinsured, and those who can't afford their care, those at the jail, those at the juvenile detention center, those who rely on the public health services provided by the Cook County Department of Public Health. Now, years ago, when I would talk to the interns as they got started at Cook County Hospital, I frequently read to them the phrase that sits on the plaque at the base of the statue of Louis Pasteur in the park just north of Old Cook County Hospital. Pasteur had said, "One does not ask of one who suffers, 'What is your country? What is your religion?' One merely says, 'You suffer. That is enough for me.'" This has been and will continue to be the driving ethos for our health system. Our ability to carry out our mission has a ripple effect, though, throughout all of Cook County that you should appreciate. By keeping people healthy, we keep them working, supporting their families, and contributing to the vibrancy of the local economy. By addressing the behavioral health issues that I've alluded to, we're keeping people out of stressful and expensive correctional health systems where they don't get better. And by opening our doors and keeping our doors open to everyone, we're protecting not only the health and dignity of every individual that we care for, but also for the community that we all live in. The path before our health system is not without challenges, to put it mildly. The changes we must make are not easy for an organization that in many ways has been doing business for 180 years in much the same way. But this transformation is critical to our success, our future, and most importantly, our mission. Assuring that our 6,700 staff and our partners in labor are aligned with this transformation, that all recognize their own individual contribution and responsibility to achieving safe, high-quality, patient-centered care, and thereby continued relevance for our proud organization is my primary responsibility. So, this is not your father's Cook County Health and Hospital System. The changes we need to make will require a great deal of work, but we're not afraid of hard work. We look forward to burnishing our proud legacy and transforming in a way that the public continues to see our value as a stabilizing community asset that improves the health of the region. Thank you for your time and your attention today. Thank you. Now comes the shooting gallery.
Starting off by saying, I will assume that many of those people who stood up were not family members or employees.
A couple of them, yeah.
Just so we clear the air there. Okay, here we go. Bobby, the Edgewood Historical Society and Museum. Bob, what's your last, Remax? Reamer. Since my wife's last name was Remax, I get a little nervous when I see that. Okay, here we go. Is there any likelihood there will be a medical museum at the old County Hospital building. They don't come easy, do they?
Actually, that's not too tough. It remains to be seen. Many folks in the room are aware that right now we're in the process of engaging 2 RFPs that will importantly develop the West Side Medical Campus. There's a core medical project that will be providing a new building for clinical care, ambulatory clinical care, and office space on the Stroger campus. And at the same time, there's what's referred to as a market rate development, which is being led by the Bureau of Asset Management from the President's office. That group will be developing with an architectural and design team plans for the entirety of the north and east part of the Stroger campus, including the old Cook County Hospital. Whether or not, Bob, they include a museum in the ground floor of that, which sounds like a great idea, remains to be seen.
Sorry, Bob, I don't recognize your name, but calling the Cook County, creating a museum at Cook County Hospital, the old one, some of us who worked there briefly, way back when thought it was a museum, so just so you know. Sorry, Madam President, that was just personal. Okay. Bruce Handler, where are you? All right. Please comment on any difficulties hiring of mental health staff, e.g. CERMAC.
So the questioner is alluding to the fact that while I talked with you about the challenges that we have with healthcare professionals with background in behavioral health problems across the board, this is an especially acute problem in correctional health services. In 2011, the feds retracted something that's related as the health provider shortage area designation from municipal and county jails and relegated that designation in the correctional world only to state and federal prisons. This caused a big problem for us because one of the ways that we used to recruit people to work in what's admittedly a very challenging environment was to give them the opportunity for some of their education loans to be repaid through that process. And in so doing, we lost about a half dozen psychiatrists, some physician assistants, and some psychologists working at the jail. We're happy that Senator Durbin has introduced legislation to get this reversed, and we're guardedly optimistic that that'll get passed in the next 12 months. In the meantime, we are pulling out all the stops and doing a variety of things to try to recruit professionals, particularly in behavioral health, to correctional health services. It's an important thing to point out, and most people, I imagine, the overwhelming majority of you have never worked in correctional health. I have. And it's an interesting thing that you find out once you get in it, it's good work to be in. And we find it can be very, very rewarding. But getting people into the front door to actually start to experience it can be a big challenge, and it's a significant one for us at the jail.
We have one more question. If you have a question, we have people by each door. Just raise your hand and they will scoot over. If not, this will be it. Esther Corpuz.
Our kids went to school together.
Oh,
It better be an easy one, Esther.
it's not. And that's the what medical center?
Olivio.
Olivio. You know, you could see why I'm the guy they pick up here. Just the vast amount of knowledge. And wait, there's a big, no, I'll just say it. Here you go. In your remarks, you talked about improvements being made to our outpatient clinics. What are your plans to further partner with FQHCs? Oh, we all know what that is. Yeah. No problem there. The LF, some of us should say FQ. No, he's not here. All right, who are providing primary care in vulnerable communities.
All right, so I'll explain some acronyms. FQHCs are federally qualified health centers, sometimes also referred to as community health centers. And these play a critically important role across the county. I'll just give you a sense of that. When we first went to the feds back in 2012 and talked to them about the idea of creating county care, one of the things that they told us firmly and from the get-go is, we're not going to give you a head start on Medicaid expansion if you think it's only going to be at Cook County Health and Hospital System and your clinics. We, the feds, are responsible for the entire population, and we think county-wide. So give us a plan that works for the county. That's the reason why we had to build the network that we did that included all the federally qualified health centers as primary care franchises, because there are actually regulations in our deal with the feds to create the health plan that says you've got to be able to provide a primary care home within X number of miles of the member. So we look at the federally qualified health centers as critically important partners in this activity. There's not enough stuff that we can do in our own clinics. So again, if you think about that background of 140 primary care sites, only about 16 of those are Cook County Health and Hospital System. The others are Alivio, Esperanza, Erie, Access Community Health Network. They're critically important parts of the safety net. Increasingly, we think that they play a very, very important role, but increasingly we find that we remain the source for them to refer to when they've got complex problems beyond what can be provided in that community-based center. So that partnership is robust. It'll be an important one going forward.
How about a big round of applause? Hold on.